touch.
Okay.
Oh,
yeah.
Amazing.
Oh, really like
This is going to be behind the scenes. Hi everyone, good morning and welcome to another episode of Sembang Tak Kosong. So I'm Adeline, and with me today I have a new co-host.
I'm Siti.
Yes.
Call me Siti.
Let's welcome Siti. Siti is also my colleague and writer.
I'm a new writer.
Yes, and Siti has a nutrition background as well.
I do have a nutrition background, yes, but then a degree, so bachelor's. What is it called? Bachelor's degree.
Yeah.
Bachelor in science. Bachelor in science in nutrition. But then I discovered that I really like communicating more. For now, we don't know. We don't know for sure. But for now, I do enjoy doing this, and it's just communicating the
fun
facts
stuff
to the fun facts, correct ones to the public.
Yeah, because we understand that, there's a lot of information going around about health. And, Siti is also here to help us out to debunk, demystify, and to make sure that it's Sembang Tak Kosong and not Sembang Kosong, right?
It's gotta be tak kosong.
So today's topic, Siti, is really, really interesting because it is going to resonate with us women especially.
Yes.
So anyways, we're interviewing a doctor, a gynecologist. To be correct, she is a obstetrician and gynecologist, as well as a gyne-oncologist and a laparoscopic surgeon.
Oh,
So that's quite a mouthful, but that's also a lot of experience.
a lot of experience, even from the titles. Yes.
So, I hear a lot from my friends, and I'm sure you do as well, about the term endometriosis.
Endometriosis.
Yes, I'm sure you heard about it too.
Yes.
Have you?
I
Yeah.
have.
What do you think about it? I mean, the minute you hear about endometriosis, what comes to your mind?
Hormones, period, pain, the pain itself, and then like not baby, like the baby, but just them being able to have a baby or not. Fertility lah.
Fertility, right? Yeah, I have similar thoughts too, actually. Because when I think about endometriosis, I mean, I hear a lot of my friends being diagnosed with it as well. And the first thing they worry about is being able to conceive or not. Yeah, because it's a part of your reproductive system as well. So is it obstructing the way? Is it gonna cause any issues?
Totally.
Is it gonna affect baby's development as well? You can never know, right? I mean, I don't know how is it supposed to be.
I know that's why we're here, because we don't know. Like when I hear these diseases, I think of things in my head, but I don't know how it works or what is it really. Because so far, personally, I've never had it.
Yeah, thank God
myself. But obviously, we've had like friends and families who went through all this, and I know it's kind of hard for them, but we don't really talk about it. That's the thing. I feel like there's a barrier around us from not talking about it, and I feel like it's just taboo. Whenever even if I go to my sister, a close one, and I ask my sister like, hey, how is she dealing with it? And then she'll be like, let's not talk about it. Let's just not. It's a sensitive topic, la 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 la. So it's like we kind of like tiptoe around the topic and we don't talk about it. Yeah. So that's why I think even I don't know a lot about it, and I feel like a lot more people around here, out there, who don't know.
Yeah, because we always think about it being woman-y issues.
Girl issue, and then don't talk about it.
Yeah, because it's sensitive, it affects your private parts, so I'm really shy to talk about it. That's what a lot of people always think. But, today at Sembang Tak Kosong, we want to normalize this, guys. We want to make it okay to talk about our woman-y issues.
Yes.
And more importantly, to understand what exactly they are. So we have here with us today Dr. Khoo Boon Ping.
Khoo Boon Ping.
Yeah, Dr. Khoo Boon Ping, who is also, as mentioned earlier, just to recap, consultant obstetrician and gynecologist, as well as Gyne-Oncologist and a Laparoscopic Surgeon. So Dr. Khoo will be highlighting and talking to us, as well as to debunk the many myths surrounding the topics of endometriosis, adenomyosis, and fibroids. So welcome, Dr. Khoo.
Thank you for the invitation. I'm so glad to be here today.
Yes, and we are very happy to have you here as well. So today we're going to be talking about understanding endometriosis, adenomyosis, and fibroids. We often hear a lot of this from our friends and things like that, but honestly, what's the difference between them, doctor?
Okay, actually, endometriosis is, by definition, is the abnormal migration of the uterine lining. So, as we all know, our uterus, we have a uterine cavity with a lining where it gets thickened and in preparation for pregnancy. So, if pregnancy does not occur, it actually gets shedded off and it gets expelled from our uterine cavity as our menses loss. Okay, so that is normal mechanism, but sometimes some of the endometrial lining gets migrate outside of the endometrial cavity. So one of the commonest hypotheses is, it gets backflow through our fallopian tubes into our pelvic cavity.
I see. Backflow.
Backflow.
Oh, okay.
Yeah, so it actually gets deposited in anywhere, around the uterus or even at a further location. And every month when the hormone stimulates it turns like endometrial lining, it gets stimulated and then it bleeds, it gets inflamed. And when the menses ceases, it actually gets resolved, inflammations are stopped as well. So it goes in a cycle. So it gets stimulated, inflamed, and it gets resolved in multiple menstrual cycle. So how about adenomyosis? Adenomyosis is also the abnormal migration of the uterine lining, but this time it gets migrated into the uterine wall muscle. So it gets deposited into the muscle layer in between the muscle fibers, and it gets when it gets stimulated, it bleeds inside there, and it causes a lot of symptoms.
I see.
Yeah.
How about fibroids, doctor?
Fibroid is a slightly different. Fibroid is an abnormal growth of a fibrous tissue within the muscle layer or below the layer of the uterus. Yeah. So it is. It does not cause inflammation and all, but it gets bigger. It's usually stimulated by female hormone as well.
Ah, okay. And are all the symptoms of all three of these conditions the same though? Because they sound like very...
It sounds like very similar. So they share some similar symptoms, but some are typical for one and another. Okay, so let's take fibroid for instance. Fibroid usually depends on the locations. The problem with fibroids is it gets bigger and bigger with hormone stimulation. So depends on the location, it causes various symptoms. So the commonest symptom would be pain. When the fibroid grows significant big enough, then it causes stretching and it causes heaviness, so it causes pain.
I see.
Yeah, and sometimes the locations gets very near to the endometrial cavity. It actually stretches the endometrial cavity and causes heavy menstrual bleeding. Yeah, so heavy flow is one of the symptoms of fibroid as well. Yeah, and of course, if it grows out in proportion, it can compress in front of our urinary bladder, causing urinary symptoms. Sometimes can be mistaken as urinary tract infection, and it can also pull the uterus back and compress on the rectum, and that can be mistaken of constipation when we need a bit more effort to pass motion. Yeah.
Wow. Okay. And then how about the symptoms for endometriosis and adenomyosis?
Okay, endometriosis and adenomyosis usually causes pain. It could be a mild to moderate pain to ranging all the way to severe pain. So it depends on the severity of endometriosis. So a mild endometriosis sometimes just mild pain, mild to moderate pain during first few days of menses, and it gets relief. So a severe type of pain, severe type of endometriosis, the pain is more subtle. It actually gets more prolonged. It could happen even before menses, just a few days before menses. The pain will start, and then it get worsened throughout menses, and it lasts throughout the post-mensal period as well.
I see. So for fibroids, there's pain as possibility of pain as well.
Yes, when it gets big enough, and then when there is a condition where fibroids, we get blood supply from periphery. So it gets blood supply from the exterior of the fibroids, and as the size grew bigger, the central part of the fibroid actually is devoid of blood supplies. So that can causes inflammation, and it can cause a severe pain.
I see. Okay, but not necessary.
Not necessary.
Only when it gets severe.
Yes.
Okay, whereas the other two conditions, it's commonly associated
with bleeding and pain. So adenomyosis, other than causing pain, it also causes a heavy bleeding because of chronic inflammation of the uterus.
I see. Okay, so doctor, you mentioned previously, okay, so it goes with the cycle, right? That means, so that's the thing you differentiate lah.
Yes.
In other words, as compared to fibroids,
Yeah.
adenomyosis and endometriosis kind of goes with the cycle, the menstrual cycle.
Correct. Yeah.
I see. Okay. How about risk factors, doctor? Like, are all women at risk, or is there a certain group of women at risk?
Certain group of women, I would say. So for those, obesity, of course, is a risk, and then chronic stress, and genetically, and predisposition. Yeah.
Wow. Okay.
So actually, the percentage of a woman getting this problem is actually as high as 10%. So every 10, there will be one. Every 10 women occur, there will be one woman suffering with this kind of problem.
But we hear that a lot, right, Siti? Like from our friends.
They are friends and family.
Yeah.
And the thing is, because you said the symptoms are like pain,
Yes.
severe pain, but then most of the time people push the pain down.
Correct.
And then we're all like, because we've been having periods since 15 years old, or even earlier 12 years old. So we've been having like period pain since the beginning of having periods. So
Correct.
as you get older, period pain is nothing. So how actually do people differentiate like period pain? Is it normal, or is it actually not normal at all?
Yeah, so period pain, as we know that period, is associated with inflammation, so it can cause pain. So mild pain is most of the time normal. But like you say, what are the type of pain that can be differentiated from just a normal menses, or is something more than just menstrual pain? So like the pain causing back pain, something like, the pain is like pressing on our backbone. So that is quite typical of posterior endometriosis, where endometriosis get deposit at the behind part of the uterus and causing inflammation there. And pain during intercourse. Yeah, as well, when there is inflammation, it gets thickened and all when it heals. So when there is a sexual intercourse, the movement itself, can trigger the pain as well.
Wow.
Yeah,
So it can really affect a woman's life.
it really affects a woman's life.
Yeah, really terribly, especially with the pain.
Yeah.
Cases. So a lot of women are actually suffering in pain. Some of them, they are as bad as a lot of times they have to take off during the first 1 or 2 days of their period.
Yeah.
And then they cannot even get out of the bed, so they have to curl themselves, in a blanket on the bed. So that is definitely something not normal.
I see.
Wow, that's not normal.
That is definitely-
That is so normalized, actually.
Yes.
So normalized.
So many women around us are actually suffering in this kind of a manner, but not reaching out for help.
Yeah, but then the thing is, the reaching out for help part is just not in the mind of us helping.
Because we think it's so normal, right? It's like if you were to search on the internet, symptoms of menstrual cycles, pain, it's the back pain. Yeah, back pain.
So I'm not saying that every woman with this kind of pains are equivalent to endometriosis, but when they have this kind of severe pain, the chances of them having endometriosis is actually quite high. So back to the percentage we see, 10% of women are suffering with this kind of problem. Actually, I would think that is underreporting because we do see so many, coming forward nowadays because of awareness and all. Yeah, but still there are quite a lot of women are just not coming forward.
And doctor, like Siti said, we for women, generally, we start our menstrual cycle in the teens.
Yes.
Could it also mean, like, can endometriosis or any of these conditions start as young as that?
Can. Yeah, so of course, the chances of getting of endometriosis at young age is not as high as more advanced age. So typically, women in their 30s or 40s are more likely to get this kind of a problem. Yeah, but we do see girls at a young age are actually having endometriosis as well.
Is it because of the genetics or stress?
Yeah, genetic stress and the first few years of our menstruation, actually the hormones level are not so stable. Yeah, so that is one of the contributing factor as well.
Could food be part of it? So, how they say, they inject chickens, meat, stuff like that. Can food be?
Definitely food plays a lot of important roles in this, like food, the food we eat actually, determines on how our body works. So the most worrying part of taking, the wrong type of food would be those, highly processed food, those contains a lot of chemicals and all. So a lot of artificial substances inside there. So that after ingestion to our body, it causes a lot of inflammation. So it's that inflammation that, causes our body to undergo a chronic inflammation, which will upset all our hormones and to cause possibly cause all this problem.
I see. Wow. And doctor, you mentioned in the 30s and 40s, women in their 30s and 40s is definitely more common.
Yes.
The risk is it's kind of like higher.
Yeah.
But will it affect fertility though? Because that's also the age where women want to get pregnant, have family and stuff. So
actually, it does. So endometriosis, adenomyosis, and fibroid does not mean that it stops us from getting pregnant. It's not equal to infertility, but it actually reduces our chance of getting pregnant. So, for instance, our fibroid, the size of fibroid, the location of fibroid, depending on those, it can alter the endometrial cavity structure. So when the structure of the endometrial cavity is altered, then it actually hinders the implantation of our pregnancy. So that itself can reduce our pregnancy rate. Adenomyosis and endometriosis, they are chronic inflammation, meaning to say, a prolonged inflammation. So pregnancy, when we have a surrounding which is inflamed, toxic. So even if we are able to conceive and then the implantation does not take place because of the hostile environment. So it actually reduces the chance of successful pregnancy rather than it does not allow pregnancy. Yeah, we do come across, women with endometriosis, multiple endometriosis, they are still able to conceive.
But because it's something there, will that affect like the baby?
No. Yeah, so it only affect the successful pregnancy rate, meaning to say is either it actually allows the pregnancy to take place, or it does not allow the pregnancy to take place. So once the pregnancy is successful, then if it progresses well, then the endometriosis does not cause harm to the baby.
Doctor, the keyword that I pick up is inflammation.
Yeah.
Right? We also see a lot of advertisements and things like that about anti-inflammatory, will that help with this kind of conditions? If you take certain supplements and all, yeah.
Yeah, definitely there is some rules. So the commonest type of inflammation would be the one caused by stress. Yeah, so supplements, we know that a lot of supplements are actually quite effective in reducing stress and all. And the nature of our urban folks, so the high pace of life, every day we have to rush over, we have to meet our dues, and then, we work until late and we have to reduce sleep quality and all those things that once promotes inflammation as well. Yeah.
So not just supplements, it's also your way of life.
Yes, way of life, our lifestyle, and our sleep quality, and also exercise.
Yeah. Okay. So
is that like one of the treatments when a patient consults with you? What would the treatment be? Is it just lifestyle or what else?
It's more than lifestyle. Of course, lifestyle plays a big part of the treatment because we can give good medicine to try to cure it or try to reduce the problem. But then the root cause of the inflammation and all those things need to be solved as well. So if that part of the inflammation is not being tackled, so if it's just still the problem is still there. Yeah.
Okay. And doctor, you like you mentioned pain and all these symptoms, which is normalized in a way. So how do you help your patient? Because as women, we often feel like it's normal, nobody hears us out anymore, So yeah, in terms of mental health impact as well for your patients with endometriosis, adenomyosis, or even fibroids, how do you help them or how do you guide them in terms of managing the mental health impact as well?
Yep. So before we go into mental health, so each women who comes to my clinic, or see other doctors, we have a detailed assessment of how is the severity of the disease first. So it's either the first one, of course, is by clinical examination. So that includes a vaginal examination, abdominal ultrasound, or pelvic ultrasound. That gives us an idea of how bad is the problem. Whether there is visible endometriotic cyst, meaning say the ovaries get swollen because of endometriosis, or the uterus gets swollen because of adenomyosis, or even you can see a fibroid. So depending on the assessment, then we will propose different types of treatment, and of course taking in consideration of fertility desire as well. So for a lady who is in their 20s to 30s, who are most likely would want to get pregnant and all, so the treatment would be slightly different as compared to a person who is perimenopausal in their late 40s or to 50s, those which is focus more on the symptoms or treatment of the disease rather than to preserve the fertility. Yeah. So that also to assess the patient and then being able to lay down the condition to the patient and the severity, that gives a very good understanding of the problem to the patient. So at least a big part of the doubts that, am I having a really bad one or am I just having a very mild one? That part of the puzzle is actually filled up. So after which we comes to the treatment. So treatment could be hormonal to suppress the endometriosis, suppress the adenomyosis. We have also medicated intrauterine device, to insert into the uterine cavity to helps in to control the pain and also bleeding. So those are mostly for symptomatic control. So for those who desire to get pregnant, so a more aggressive or more drastic treatment which should be discussed. So there comes the part of a surgery. Yeah. So one may ask, doctors, if we can take a medicine to suppress it, and then why we need to go for a surgery?
Yeah.
Yeah. So we know that the disease is there. So the hormones and the pills are, just to suppress it, temporarily. But the problem does not get solved. And with the ongoing, every month you have a period, the inflammation goes on and it goes in a cycle. It gets inflamed and then it gets resolved, and it further damage our reducing number of eggs as well. As we all know, we are born with a certain number of eggs, and then every cycle of our period, a big number actually gets stimulated, and and the numbers are actually reducing with each cycle of menses. And on top of that, the endometriosis actually causes more disruption. So if it's left untreated and all over a longer period of time, it would reduce the egg volume, and thus reduce the chance of getting pregnant.
Wow.
Yeah.
But doctor, would that mean that ultimately it boils down to surgery being the main treatment or the solution to help?
That is actually still under is an ongoing debate for quite a long time. So some two schools of thought. One school of thought is actually to suppress the disease and all, and to control the symptom and not to damage so much of the egg. But another group of school of thought is actually, to go in and try to remove the lesions, those that get causes destruction. So we try to remove as much as possible so that to restore the pelvic anatomy, the structures, and reduce the culprit tissues that, causing inflammation. In that sense, to improve the quality of the eggs and all, so that in turns helps in helping in successful pregnancy. Actually, there are quite a lot of evidence, talking about both. So maybe I should say that medical treatment like painkiller, hormones, those are mainly to control the symptoms, but to really helps in to get someone to improve their chance of getting pregnant, I would say, should consider a surgery to try to remove as much as possible, and at the same time, not to damage so much of the eggs, and thus, helps in a successful pregnancy. So there has been numerous publications, talking about the successful pregnancy after surgery. Yeah, so it is as high as 45 to 75% of pregnancy rate after good surgery. But of course, an endometriosis surgery is one of the toughest surgeries in our gynecological scope. So the first surgery is always the most important one. So it actually dictates how the recurrence rate and the successful pregnancy rates and all. So if at all we are going for a surgery, the first surgery has to be done proper, and it's preferably to be done by someone who are skilled and experienced in this kind of surgery. Yeah.
Okay. Doctor, once it's removed after surgery, I'm just thinking because like the hormones are, somebody's built that way in a way, or the system is already such. Can it grow back or will it return?
Definitely. So endometriosis is actually one of the commonest problem that actually recurs. It grows back. Yeah, that's why again back to the first surgery. If we do a very good surgery, I wouldn't say that we can 100% remove all the affected tissues, but at the fact that if you can remove as much as possible, we actually reduce the chance of recurrence. Yeah.
So that's why it depends on the first surgery.
The first surgery must be, it is very crucial to have the good surgery in the first surgery. Yeah.
Okay, that's something that everybody should take note of.
Then a little bit about for those who are controlled with symptoms controlled with medications like hormone pills and all. So do they get pregnant as well? So yes. Of course, by controlling the symptoms and all those things, it also reduces the inflammation. So some women actually conceive after undergone medical treatment as well. But the successful rate is not as high as surgery. Yeah, especially those, we have stages of endometriosis, just like cancer. So the earliest, the milder stage would be stage 1 and stage 2. And then, of course, we have stage 3 and stage 4, which is, quite a bad one. So those bad one actually are those that, require surgeries, in order to help in improving their fertility. Yeah.
Okay, wow. And doctor, you mentioned like endometriosis, it's like a growth, right, doctor? So, and I'm just thinking, is it a lot of people, would they think that it's some kind of cancer? Like, because people often associate growth with cancer, right? So, yeah, could you just clarify that part?
Yeah, so two schools of thought also, for me, like me, a Gyne-Oncologist, so, the cancer specialist. So, a lot of time we see something and the first thing we think is like, whether it's cancer or not. But then that may not be the truth all the time, because we know that cancer incidence is actually lesser than having a non-cancerous lesion. So the incidence of getting endometriosis in our ovary is actually much higher than we're getting a cancer from the ovary. Yeah, but of course also depending on the appearance of the ovarian mass that we see. Sometimes, at a glance, it looks very much like cancer, but then sometimes it just looks like very much an endometriosis. Then again, the risk of endometriosis progressing into cancer, meaning to say, from an endometriosis, it turns into cancer. So the percentage is about less than 10%. So it's actually not so high as well. Yeah, but of course, for a person who having it for maybe for years, so we do see patients, let me give you an example. I have a patient came to me, the last seen doctor was 10 years ago. Already there is a big, two big endometriosis. One side 8 centimeter, the other side was 6 centimeter. So she was lucky that the pain was not so bad, but she just skeptical about whether she should get it removed or not. So those kind of patients, after a long years, would it be a chance of turning into cancer? So obviously there is a chance lah. Yeah, but that need not always be cancerous, and resulting from endometriosis. Yeah.
Okay.
So there are other things that we can guide us whether it turns to a cancer or not. For instance, for endometriotic mass ovarian cyst that has a lot of solid areas and all. So the chances of it becoming a cancer is actually more. Yeah. So if with that information at the back of our mind, do we suggest everybody to go for surgery or not? So logically, if there is a chance of getting cancer, then everybody will think, hey, cancer is like this sentence, I should get it removed. Yeah. All right. Yeah. So that may not always be the situation.
Okay.
Okay. We assess the patient as a whole.
First.
Yeah, and then depends on the risk factors and all those things, and the appearance of the mass, and of course the level of the tumor markers. We do know that cancer markers can be raised in endometriosis as well, because inflammation. Yeah, but of course when it's in to 4 digits, then it's something is not really right.
Okay, so it's really individual case to case.
Individual case, yeah. But then endometriosis does not equal to surgery, meaning to say it's not a must to have a surgery. But when the endometriosis is severe, it causes significant symptoms and all, then surgery is something for us to consider. So at least for those who are occurring in their bed, every first or second day of a menses, those kind of those group of people, they should have something done at least to elevate the pain. So we need not every month, suffer in that kind of pain,
Yeah.
Yeah.
So after surgery, after surgery, that would mean there's very little to no pain left?
Yes, our aim is to reduce the pain to a tolerable level. So we do have patients that the pain has become minimal. That would be the best result. But a lot of times, for instance, our pain score, the maximum pain score is 10. So a lot of women are coming with a 9 or 10. So after the surgery. Yeah, after the surgery, if we could bring it down to 1 or 2, that is a significant improvement. So 1 or 2 pain score, it's just like our normal menstrual pain. We need not require any painkiller. We can function as normal. So if we can reduce the pain from those kind of, curling on a bed in a blanket to, walking around and doing our daily chores, I would say that is a significant plus point.
Wow.
Yeah.
So many people I know who needs to be just in bed.
Yes.
So they need to get something done, right? So speaking of all this, pain that is normalized, what do you think about like earlier intervention? Will it make any difference in the outcome of the treatments?
Definitely. So, for instance, you need not every day try to hold the pain, and then suffer by yourself. So at the least would be, some painkillers, some anti-inflammatory medicine, to help to ease the pain. Yeah, if the symptoms becomes very severe and all those things, laparoscopy surgery would have give us a very good idea of how bad the affected areas. And if you could remove the affected area early, so logically the lesions grow and then it gets spread around the surrounding structure. If we remove it early, then the chances of it spreading to a bigger surface area is lesser.
Oh, okay. And as you said before, the first surgery is the most important one, right? So the earlier you do the first surgery or first intervention, whatever the treatment is?
I would say, of course, when we diagnose it, you have a significant problem causing you significant symptoms, then we should plan a surgery. But the importance of first surgery still lies in the quality of the surgery, meaning to say how much we remove. We aim to remove as much as possible, but at the same time, not to damage so much of the surrounding structure. So that is actually quite challenging. Yeah, so it requires a lot of skills and a lot of experience to achieve that.
Is it going to be open surgery or?
Traditionally open surgeries, but nowadays, thanks to our minimally invasive surgery, by our laparoscopy surgery, so that has a superior advantage in terms of minimal pain, post-op pain. So just imagine we have a long 30 centimeter incision of our abdomen. So compared to a 1 to 2 centimeter small holes on our abdomen, which one will cause more pain? Definitely. The ones, right? So the bigger ones, after the surgery, we because of the pain, we are not able to, get out of the pain as fast. And then every time we try to move, it actually causes pain. But this kind of pains actually is not there in laparoscopy surgery because the hole the incision is so small. But of course, inside the wound, the wound inside is still the same. The pain actually is not as painful as our abdominal scar. Yeah.
Okay. Doctor, just wondering, now that we're talking about treatments, could you just briefly run through the different types of treatments available and its advantages or maybe disadvantages as well, just for our viewers to understand as well? Because I think a lot of times people tend to get confused, what's the difference and stuff like that. So perhaps could you just do a quick one?
So mainly we divide into medical treatment, meaning to say taking medicine, and surgical treatment, which is surgery to remove the lesions. So the first treatment is always, medical, to give some medicine, at least the patient comes with pain, came with that kind of thing. We reduce the inflammation, we reduce the pain. Then we have the assessment. So ultrasound assessment, even an MRI. Then we have a better idea of, how extensive is the disease. Then we can plan for a surgery. Yeah, so different types of medicine, painkiller. So some things like non-steroidal anti-inflammatory disease, drugs. So those are the commonly known as painkiller. So that one is temporarily control and reduce the pain. And of course, hormones. Hormones, just like our hormonal pills, are actually more famous and known as contraceptive pills. Yeah. So that one actually stabilize our hormones, and it can suppress the hormones that stimulate the endometriosis. In turn, it actually keeps the endometriosis inactive. But it is a temporary measures. We do have injectable hormones as well. So that create a state of temporary menopause.
Oh,
when you say we block the higher hormones to stop the period temporarily. So when the period is stopped, then the inflammation is not there. So endometriosis get inactive. But it's also a temporary measure because the effect of the injection actually lasts for a certain period of time. So typically, it used to be a monthly injection. The one injection actually lasts for 1 month. But nowadays, we have a one injection lasts for 3 months.
Oh.
Yeah. So, and of course, another one would be like for adenomyosis, we have intrauterine device with hormones. So in Malaysia, it's known as Mirena. The brand is called Mirena. Yeah. So other than that, coming to surgery, then surgery traditionally is open abdomen surgery. So we have a big incision, either vertical incision or a transverse incision, like a Caesarean's incision.
I just see that.
Yeah. So nowadays we have a minimally invasive surgery. So that includes laparoscopy surgery, robotic surgery. Yeah. So what are the advantages and disadvantages of laparoscopy surgeries? So let's talk about the advantage. So the advantage of laparoscopy surgery is reduce the pain. So when the pain reduce, early ambulation. So early ambulation meaning to say we can get down from the bed after surgery much earlier than open surgery. Yeah, and then we can return to our normal activity faster. and it gets discharged faster as well. So with early ambulation, early movement, it reduces the risk of bowel problem. Now, a lot of times after a long surgery, our bowel gets lazy. It does not move as fast. So we can have a temporary abdominal bloating sensation, unable to pass flatus. Sometimes the worst one, will causes abdomen to be stretched and painful, and some even vomiting. Yeah, so those kind of things can be potentially reduced by minimally invasive surgery. Yes, and the technology itself. So our eyes, although our eyes has a higher resolution than most of our TVs but then it is not so easily zoom in and zoom out, right? So our laparoscopy has advantage of enlarging the image on the screen. So those days it was a standard definition a long time ago, and then it comes a high definition, and nowadays we are talking about 4K resolution, which is really good. And a 4K resolution on a 30 inch, or now we have a 42-inch monitor, is like luxury, in operation and all. So we don't, if we are operating with our eyes, then to zoom in, we have to really move our eyes very close to the operating field, right? So that also depending on the age, and then whether we are having short-sightedness, and so that will further limit our eyes and all. So that is the advantage. Enlargement of the operating field, and also the angulation of the camera can be positioned in such a way that a certain angle that our eyes cannot reach, the camera can reach. Yeah, and we even have a 3D image, 3D monitor for laparoscopy surgery. Yeah.
Oh, wow. Yeah. So in that sense, precision is definitely
better.
Yeah.
Yeah.
Okay. Wow. In terms of the options women now are going for, are more women going for minimally invasive surgeries?
Yeah. Who would want to go for a big scar? Like a review track on our tummy, compared to just a few small holes,
Yeah. Cost-wise though, doctor?
That comes to the disadvantage because, technology comes with a price. So traditional open surgery, we don't need all this hi-fi, camera system, and then all the energy device instruments and all those things. So that can easily save a significant amount of money. So that's why when we talk about minimally invasive surgery, there is always more cost incurred compared to a laparotomy surgery. Yeah.
Okay.
So a lot of people actually thinking, doctor, and the other person, had it done with a very cheap price and all those things. And then why, when you talk about laparoscopy surgery, the price is so much more expensive. Of course, the instrument itself. So we have energy device. Energy device is like a cutter with a sealer, combined together. High technology lah. So traditional surgery and all that, we would have been clamp the structure and then divide it and then use a suture to tie it. Yeah, even nowadays we have an energy device to use on the open surgery as well. But then in laparoscopy surgery, we tend to use more energy device. Yeah, so that piece of a hand instrument with the generator itself is already cost quite a bit. Yeah. But being said, that is not so much more compared to open surgery. So it's just more lah.
Okay, in terms of time though, doctor, like time taken to perform the surgery, I would assume minimally invasive will be shorter?
Not really. So traditional open surgery, we don't need to set up the system. We don't need to position the patient in such a way that we need to do the laparoscopy surgery. So the setup of the positioning, the setup of the camera, the we call it the laparoscopic tower. So to get ready the instrument, and not easily half an hour to 45 minutes. Yeah.
And for open surgery, how?
Open surgery is much shorter lah, because we just need to lay out our instruments and all. We just have to incise on the operating field and gets in, so it gets in faster. Yeah. So but being said that, nowadays our laparoscopy surgery, the time duration is already matching our open surgery already. most of the time. So that again depends on the experience and the skill of the surgeon. Yeah, but of course there are some complicated cases, particularly difficult one would have been taken a longer time.
Okay, thank you for clarifying, doctor. I think that's very helpful, especially because when we are caught in this kind of with the news and everything, sometimes to understand treatments and all, it can be very difficult, especially for a layman person.
Yes. That's why it is important when you identify yourself might be having something. So don't hesitate, just come and see us. Yeah, so it would be good if we don't find anything bad for you. It could be just a menstrual pain, it just requires a painkiller and all. But we wanted to find out whether, you have this kind of problem that potentially can be treated, to improve your quality of life. Yeah. So
I think most of the time it's the stigma and people are afraid. Because people are like, if I don't check for sure and then I don't have the problem. But then if I check and then I get diagnosed, then now I have a problem.
More problem. Previously, I was coping with my pain only. Now I have to cope with my pain and think of whether I should go for treatment. Either surgery or what, or I should be put on a prolonged medicine as well.
Yeah. So don't find problem like so people thing, which is not good.
The other common excuse would be too busy, no time, no time to see a doctor, after work or after finish the important chores, already the clinic are already closed.
Yeah. You're right. It's actually very hard to go to a clinic because
Work out.
When do we go?
Weekends
Weekends is okay. Weekends are always a good time. That's why now Saturday is always the busiest day.
Everybody squeezes in for the
I
weekend.
mean, if let's say we open up our Sunday clinic, I'm sure you'll be packed as well.
Yeah.
So many people have only that time to go anyway.
Yeah. Right. And doctor, just wondering, for those who say they go for health screenings and things like that, can these health screenings pick up any of this condition?
Yes, of course. So most of our health screening includes abdomen ultrasound. So an abdomen ultrasound would have pick up, fibroid or even endometriosis, ovarian cysts and all those things. Yeah.
Okay, so just go for a checkup.
Yeah, health screenings are important, and so regular health screenings, yearly, right?
And a lot of times our health screening also includes a cancer tumor marker. So particularly a CA125. So CA125 with increases, even a borderline, it warrants, a further investigation.
I see. That's how important it is. Yes. Wow. Okay. So last part, doctor, moving on to myths.
The myths, yes.
Yeah. The fun part. So like we mentioned just now, endometriosis, adenomyosis does not equal to infertility. So meaning to say, you are not always you have endometriosis or you are chopped and sealed, you cannot get pregnant.
Interesting.
There are still ways of get pregnant, and there are also possibility of milder endometriosis, adenomyosis, with a successful pregnancy. Yeah.
Okay. And doctor, is it true that endometriosis only affects the reproductive organs?
No. Also, of course, the commonest organs affected are the reproductive organs, but those rarer and more severe type of endometriosis, it could affect any organs in our abdomen. So, for instance, give you a few examples. When endometriosis get more severe, it can actually grows into our urinary bladder. Then something like blood in our urine. Yeah, it also can grows into our rectum. Yeah, and
how does that happen?
Yeah, I'm also trying to brain that.
It gets inflamed. It gets stick on the surface, and then after a long time, and then in a circle of inflame and resolution. So it gets every time it actually invades more and more, and eventually it goes through the whole surface and get inside of the organ.
Okay, as a layman doctor, let's just brain that. So it doesn't it's not like a virus or a bacteria, right? Where it infects, but it grows bigger, so it affects its surrounding.
Yes, it's like it eats into the layer because of the inflammation and all. So it gets healed, and then it gets inflamed again, heals again. So every time it goes, a deeper part of the tissues get affected, and eventually when it goes deeper and deeper, and then it causes the whole organ to be affected. That is quite rare. So other places, virtually any place in our abdomen, it could get deposit to our liver, our stomach, spleen, anywhere, because the abdominal cavity is actually a big cavity. So any abnormal migration of the endometrial tissue can actually get stuck in anywhere. But of course, other than the reproductive organs, it's quite rare to get endometriosis elsewhere. So other types of endometriosis we have seen before, like a cesarean scar endometriosis.
Caesar scar.
Yeah, we have a cesarean section, and then somehow the endometrial tissue, gets deposited to the scar, and then it with a menses, it grew bigger, causes pain and all.
That sounds like it hurt. It hurts.
It hurts. Yes, it has happened before. It's not so common, but it has happened before, and we do have a vulva. That means the exterior of our genitalia.
I see.
There is a mass there. Every time get menses, it get bigger and it gets swollen up and pain. And then when menses stops, and then it actually shrunk the size. Yeah. So those are external as well. Those are rare types of endometriosis.
I see.
Is it rare or is it like later stages?
It is rare.
Very rare.
It's rare. Yeah.
Oh wow.
I didn't know. I always thought that it was only
Just
affecting the reproductive area. Yeah. All right. Wow. Okay, Siti, do you want to do the second
Oh
one?
yeah, sure. So you did mention contraceptives just now, but the myth is birth control is for sure the cure for endometriosis.
No. So it is more of symptom control and to suppress on the inflammation. Yeah.
Just suppression of the inflammation.
Is part of is one of the treatment, but it's not a cure. It's not a cure. Yeah.
It's to manage lah.
Yeah, to manage it. Even a surgery, we dare not say surgery is a cure as well. And so it is quite impossible to 100% remove all the affected lesions. Yeah, so it's endometriosis is actually one of the most difficult gynae problem to treat.
Yeah.
And we hear it like so commonly that we take it's just like snap your fingers and then you can just treat it. And it just, yeah. Okay. And true or false, doctor, endometriosis only affects older women? No. Yeah, as you mentioned just now.
Yeah.
Younger.
Patients. Yeah.
Okay. Makes sense to you.
Yeah, there's one more myth that is about a cure as well. So you did mention one of the treatments is a temporary menopause. So is natural menopause a cure for a woman? Definitely.
That is true.
That is the truth.
That is the truth. Yeah, because it's due to female hormone, is mainly estrogen. So when we go through menopause, our estrogen level is at its lowest level. So the endometriosis all will be quiescent. So it will all inactive. Yeah. So even the adenomyosis, previously enlarged uterus, after menopause, it will not grow bigger. In fact, it will shrink over time.
Just naturally.
Naturally, yeah. That's why there is a group of patients, if let's say the symptoms is not so bad and they are perimenopausal, close to menopause, so another option is to actually wait for menopause.
So just manage the pain and
Just manage the pain and the symptoms. Yeah, wait for menopause, yeah.
Wonderful.
Okay, one true myth we discovered.
That is not a myth, that is a truth.
It's not a myth, that's true.
One true among the many myths.
Okay.
So I think that was our last myth or truth, doctor. So thank you so much for today and for coming and enlightening us about the endometriosis, adenomyosis, and fibroids as well.
Yep. But I would like to take this opportunity to call upon girls and women, outside who are watching this, if you find yourself having this kind of problem and you're not sure whether you're really having a problem or just a normal menses, you are always welcome to see us. We can help you. Yeah. So rather than you suffer quietly, miss your job, miss your, your favorite sports, right? So menstrual pain need not always be just a menstrual pain.
Yes, that's an important key.
Yeah. So a lot of information online. So if you go and search your endometriosis, probably you're going to get 10 millions of the articles that. But it's quite impossible for you to go through all. So I wouldn't say that doctors have gone through everything, in internet and all. But we certainly have studied enough to lay down the facts and to analyze the thing for you. Yeah. So come to us if you have a problem.
And don't be scared, guys.
Don't be scared. So we are all nice.
Not another problem. It's a chance to heal.
Yeah.
Yeah.
More of a solution, actually.
And don't suffer in silence.
What most people do.
A lot of women do, right?
And like, even if we speak up about it, then we'll be like, even women amongst ourselves, we would say, it's okay, just take a pink pill. It's a pill.
A pink pill, and then don't drink cold drinks.
And then, okay, here's a hot flask for you. Just put it on your stomach.
Okay, all right then. Thank you so much, John. Fun times.
Thank you. I have a fun time too.
Yeah.
Yeah.